following is an educational presentation of Wurzweiler School of Social Work at Yeshiva University. Visit Wurzweiler anytime at www.yu.edu/Wurzweiler. And now, this week's podcast.
Good morning. I'm Gary Stein, Associate Professor at the Wurzweiler School of Social Work at Yeshiva University and Vice Chair of the Social Work, Hospice, and Palliative Care Network. Palliative care provides pain and symptom management, psychosocial and spiritual care for life-threatening illness. Over the past decade, palliative care has emerged as a major component of care for people with serious, chronic, and life-threatening illness and their families. This presentation will focus on opportunities and challenges for palliative care in public outreach and engagement, public policy, healthcare decision-making, and palliative social work practice. A new poll from the National Journal shows that there is an emerging public consensus around end-of-life care. Overwhelming majorities of those polled support informed public dialogue on end-of-life and palliative care. Think about end-of-life issues. Think palliative care is a high priority. Support access to palliative care, and have a high trust in their doctors or healthcare provider for information. There have been challenges in public outreach. The same National Journal poll shows areas of great public distress. There's much lower levels of trust for information that comes from religious leaders, service agencies, insurance companies, the media, public officials, and political candidates. Half of the sample said that they were unprepared for end-of-life experiences. A quarter of the sample believed that the new healthcare reform law allows government panels to make end-of-life decisions. Only 40% of respondents said that the law does not. Clearly, there are challenges to address in terms of mistrust and misinformation. In the area of public policy, there are many new opportunities. We have a new healthcare reform law that will reshape the delivery of care, especially for the uninsured. Hopefully, this new law will assure access to quality of end-of-life care for all. This will become clearer as we move towards implementation of this law in 2014. Here in our state of New York, the last year has been a momentous year in terms of public policy. The new Family Healthcare Decisions Act supports surrogate decision-making in difficult end-of-life situations. Amazingly, it took 2 decades to pass this important law. Also, a new Palliative Care Information Act promotes information and dialogue on end-of-life care options for patients with terminal illness. There are also challenges in the public policy arena. The National Journal poll shows that an overwhelming 86% of the public support insurance coverage for discussions with their physicians about options around end-of-life care. However, we saw in the health reform debates, political leaders were very comfortable stoking public discomfort with serious illness and dying for their political gain in their infamous discussions of death panels. We also saw that Congress now and the current administration has been unable to effectively address this issue. But moving towards changing legislation presents some risks of its own. If we change standards of care through legislation, it may be difficult to amend these standards as they evolve. We don't always know what we get. The bill that is proposed by advocates when the bills are proposed is not the same that is passed by legislative bodies. And finally, some argue that legislation in the healthcare arena promotes an adversarial approach, which was recently argued in a New England Journal of Medicine article about New York's Healthcare Palliative Care Information Act. And most troubling, Republicans continue attempts to repeal the healthcare reform law and to significantly alter the public commitment to Medicare and Medicaid. There have been important opportunities in healthcare decision-making. Appointing a healthcare proxy has shown to be among the best options for healthcare planning. Also important is facilitating communication within families and healthcare systems, which has been critical. Communication has been bolstered by the New York Palliative Care Information Act, as well as community interventions designed to promote dialogue. For example, the program in La Crosse, Wisconsin, which resulted in 85% of the sample public completing advance directives, and a program in Rochester, New York, where 47% of the sample completed directives. There are further opportunities for healthcare decision-making. As mentioned, the Family Healthcare Decisions Act finally empowers New York's families to make difficult end-of-life choices. Limitations that have been observed with living wills have been partially addressed by the new vehicle called Physician's Orders for Life-Sustaining Treatments, which allows doctors, through their orders, to record and document patient preferences for end-of-life care. And this form, also known as Physician's Orders, known as PULSE, has been moving forward in hospitals and nursing homes across the country. And very importantly, ethics committees in hospitals and nursing facilities can effectively mediate family conflict. But there have been ongoing challenges in healthcare decision-making. We continue to see low advance directives completion rates even after the Terry Schiavo case. We're still locked at under 30% of the public having completed advance directives. It is a challenge to transform PULSE, the Physician's Orders for Life-Sustaining Treatments, into a national standard of care. It's always difficult to engage the public on planning, conversations, and care about care for serious illness. Most importantly, we need to overcome cynical political attempts to sidetrack meaningful policy and dialogue, and ethics committees in hospitals and nursing homes lack the resources to fulfill their goals. The emergence of palliative care has brought new opportunities for social workers committed and interested to this field. Palliative care's strong commitment has been to addressing psychosocial concerns. There's growing social work interest and commitment to palliative care, as evidenced by our recent conference at Wurzweiler, where over 185 students and practitioners attended. There are increasing initiatives in professional and continuing education, also evidenced at Wurzweiler, where we have just implemented our first new comprehensive course on palliative and end-of-life care. These initiatives are resulting in higher levels of knowledge and skill among social workers and the development of new models of care. Palliative social work also has challenges. There has been diminishing hospital commitment to social work, and this is largely due to a lack of funding streams for hospital-based palliative social work. And there's been inconsistent integration of social work on the palliative care team. Although there is high regard for the psychosocial approach to social work, there has been frequent marginalization in hospitals in practice and policy. Other challenges for palliative social work: we need new psychosocial outcome measures, and we need specialized training in leadership, ethics consultation, conflict resolution, and outcomes research. Thank you for joining us for this talk. If you are interested in palliative social work, please visit the Social Work Hospice and Palliative Care website at www.swhpn.org. If you are interested in social work education, please check out the Wurzweiler website at www.yu.edu/Wurzweiler. Thank you.
This podcast has been a presentation of Wurzweiler School of Social Work at Yeshiva University and may only be reproduced or presented with the express written permission of a duly appointed representative of Wurzweiler School of Social Work. For more information, visit www.yu.edu/Wurzweiler or call 212-960-0800. Wurzweiler School of Social Work, helping you make a difference.